Stay away from people, a no-nonsense mission everyone has been given as local COVID-19 cases climb, as do the death toll here in the Bahamas. Good morning, everyone. I'm Makush Lopindo with your morning edition. The news is not good, not now, and based on what health officials are predicting, not in terms of what's to come either. To put it bluntly, Health Minister, the Honorable Dr. Dwayne Sands, says the Bahamas is nowhere near flattening the curve in the fight against COVID-19. And that, of course, based on how the number of confirmed cases are coming in. Here's how former Chief Medical Officer and consultant Dr. Mercelin Dal-Regis explained it during Wednesday's press briefing.
Now what we're seeing, because the day, 4 yesterday, 4 today, 4 2 days ago, 4 3 days ago, what we're doing, we're thinking that the model that we were using to forecast the number of cases has changed. We're looking at an exponential regression rather than a linear regression. And based on that forecast, there's a prediction of almost 90 cases by Easter Sunday. But we're hoping that the model is not an exponential, but as we graphically look at it, we're a little concerned.
Dal-Regis adding that they are, however, looking at 3 other models. Now, such news comes as the Bahamas marks another COVID-19 death in a 51-year-old woman who was tested posthumously. This along with 4 new confirmed cases, 3 in New Providence, the other in Grand Bahama, ranging in ages 38 to 60. 2 females, 2 males. 1 case has been admitted to Doctors Hospital West. 2 are in home isolation and 1 deceased. Now, according to Dr. Sands, overall, the majority of COVID-19 patients are doing well. Still, some are very ill. The continued concern, community spread. And if you're still unclear, here's how dire the situation is.
People who contract this virus and become sick endure the process alone in the hospital. You are placed in isolation so as not to infect other persons. Friends and family cannot come to visit. If your condition worsens, they still cannot come to see you. Your final hours could be spent away from the people that you love. In order to avoid more deaths, in order for you not to be in the intensive care unit alone fighting for your life, we are asking you to abide by the emergency orders and public health advice. Be physically distant. Or let me say it in basic English. Stay away from people.
And for those who like to sneak out and break the rules, here's the sad reality.
There are super spreaders in our community. These are people who do not appear sick. They move around and they spread the virus to large numbers of people. Nobody's afraid of them because they don't show any signs or symptoms of this virus. So when you decide to have a party in the backyard, one of your guests might be a super spreader. He or she will laugh and talk and joke with everyone, and they will mix and mingle while spreading infection. From there, you will take the virus home to the people that you love, to your husband or your wife, to your boyfriend or your girlfriend, to your mother, father, to your children, to your grandparents. Your reckless and slack decision could kill the people that you love.
Dr. Sands making it clear that no country has enough ventilators, personal protection equipment, hospital beds, doctors and nurses to handle an all-out outbreak of this virus. Now, apart from social distancing, wearing masks, washing your hands frequently, there is something else you can do to help during this crisis, and in a big way.
When this lockdown ends on Tuesday, please donate blood. There is an urgent need to replenish the blood supply in the Commonwealth of the Bahamas. This is a simple way to help and an easy way to save lives. You can donate blood at the Princess Margaret Hospital, and all blood types are needed and accepted. However, you cannot donate if you are sick. The blood bank will be open from 9 a.m. to 5 p.m. weekdays during this period when we have weekend lockdowns, and the last donor is accepted at 4:30 p.m. Please bring some form of identification, like your driver's license or your NIB card. I need you to make donations next week. I need you to spread the word that yes, we need blood, and we need blood badly.